Okay, so what do you do for a living?
I'm a 40-year medical student at St. George's.
And how long have you been studying medicine?
4 years.
And how long is your course?
5 years.
What do you think is a fair starting salary for a doctor in their first year?
I would say at least £30,000 for the amount of training that we've done, the amount of years that we've spent in medical school. I think we need at least £30,000, if not more, because at the end of the day, the responsibility that we have, we still need to be able to pay our bills and have a good standard of living ourselves.
What do you say to people that say if you go into medicine, it's not to make money?
I think we all have our own reasons for going into medicine. I don't think, personally, I didn't go to medicine to make money, but I still believe that we should have a good salary, and it's possible to make a lot of money in medicine, although many would argue that, our altruistic behaviour and wanting to give back to others and help others is perhaps why we chose to go into medicine. However, we certainly deserve a good salary.
And would you ever consider quitting medicine?
No. Straight up, no.
And do you see yourself working your entire career in the NHS?
I would definitely stay in the NHS as long as I felt that I was enjoying it and the system was well enough funded. Even if I was to move to the private side, I think I would always like to keep some part of me in the NHS because fundamentally that is why I chose to do medicine.
Okay, so what does the NHS do well?
So the NHS, I think, is excellent at providing a good level of care to the general population, be it whether you've had an accident and you need to turn up to A&E at 2 a.m, or you've been recently diagnosed with a chronic condition such as cancer. I think the level of care is excellent, and the staff as well are very well trained and very professional.
And what could the NHS do better?
The NHS, I think, can do better with retaining their staff. I know that, the previous government have certainly cut funding to the NHS. Increasing places at medical schools is not the answer. Finding nurses from overseas also potentially is not the answer. I think we need to focus on retaining current staff, whether that's giving incentives, providing better holidays, providing better pay.
And how could the NHS value its staff more to keep them in the NHS?
Taking into account other factors in their personal lives, making maternity leave and paternity better for their staff, incentives such as focusing on mental health and their mental well-being, and other strategies to incentivize staff and just looking after the staff.